Hey guys, I am coming to you a little past 3 weeks now. Had a big oncology appointment to get my next steps for my treatment plan, so I didn't want to leave you hanging on that. Just a quick update on just general recovery from the mastectomy. Honestly, I just felt a little discouraged this week. I felt like, at the end of that first week, what was it, 8-9 days post-op, I just had like a huge improvement. And I I've had small improvement, but especially like in the last week, I don't feel like I've had much improvement. Maybe a little bit more mobility with my arms, as far as like reaching across my body, but I'm still like having all the nerve pain in my left side and still on the drug for that. I'm still taking my ibuprofen and Tylenol like twice a day. I've made myself go down to like 12 hours in between it, so twice a day while I'm awake. And the pain is just like not getting better. There's like a lot of tightness on my right side. I don't know if it's because that side, like after the fill, seemed like it was tighter than the left side. And I don't know if that's the reason why, but it just feels like there's like a lot of tightness and pulling on that side. It could also be because I'm right-handed and I'm using that side more, so I don't really know what the reason behind that is, but just, I'm not patient with myself. It's been 3 weeks and a couple days, and I just felt like I would be further along as far as my healing goes. I'm supposed to be going back to Colorado next weekend, and yeah, I think I can do it, except for like the carrying my bags and stuff, like just day to day, like I'm just tired and can't really do a whole lot, but like just hanging out, I think I'll be okay. But I don't know, I'm just feeling meh. Probably also because I had my oncology visit on Wednesday that I told you guys about. I could have gotten worse news there, but I am pretty bummed about it. So when they looked everything over from my surgery, the tumor that they removed was actually smaller, and they didn't find any other evidence, nothing in my lymph nodes. I think I've told you guys all that. So I guess in my mind, a little bit of denial set in, or like hope that like I was right on the cusp of like sometimes what they treat with chemotherapy. And so I was like, maybe there's a chance that I could just do like the Herceptin, which is the HER2 positive treatment, and then hormone therapy, and avoid the traditional chemo altogether. But that was not the case. So they want to start me on paclitaxel and the Herceptin. So it's really just one chemo drug. The doctor, we went back and forth for an hour, almost an hour. He was great. I actually really like my oncologist, and he was very nice to answer all my questions and explain everything and help me understand a little bit better. But apparently they used to treat this, what I would have, with 4 drugs, and he's only giving me the 1 plus Herceptin. So I guess I'm thankful for that, but just not really like stoked to sign up to have anything in my body that's like literally a poison. So just mentally have been working through that this week. My regimen will be chemo once a week for 12 weeks. And then once I get done with that, I'll continue with the Herceptin treatment for an additional 9 months. So that treatment goes on for a year total. Once I get through the 12 weeks, then they're okay with me starting down the path of reconstruction. So I won't have to wait the full year to get the reconstruction going. But that in and of itself is just a whole nother can of worms. And so I really have looked at this as like a 4-phase situation where the mastectomy was the first phase, chemo was the second phase, reconstruction was the third phase, and then endocrine therapy or hormone therapy blockers would be the fourth phase. So yeah, I start chemo on October 10th. This type of chemo apparently responds really well to the cold capping. They said that if you cold cap, there's an 80% chance that you can keep 50% of your hair. It's like one of the better ones to respond to that. It adds so much time to the treatments, like literally 2 hours to each treatment, because you have to wear the cold cap like for an hour before you start the treatment, then you wear the cold cap during the treatment, and then you have to wear it an additional hour after. You also have to like do a lot of stuff with your hair throughout the 12 weeks to try to preserve it. And I've heard it's pretty painful because you're essentially like freezing your head so that your nerves constrict so that the chemo doesn't kind of invade your hair follicles. Josh is like very pro me doing that, which I understand because one of my biggest hurdles with chemo was just losing my hair and looking sick. So I think I'm gonna try it and see. It doesn't hurt to try. So we'll see how that plays out, and I'll probably talk more about that as I start going through that experience. But yeah, I will take all the good vibes and the prayers I can get right now. Just kind of been a sucky week with kind of not great news, but trying to feel grateful that this treatment is possible and it could always be worse. So